Covered California, the agency in charge of the state's insurance exchange under the Affordable Health Care Act, has begun to train 2,000 people. Their goal, outreach for the uninsured to help them prepare for the plan's October 1st start date. Here with further details is Gary Rado with San Diego's Council of Community Clinics. And Gary, welcome back.
Thank you, Peggy.
Remind us again what happens on October 1st.
On October 1st, Covered California, which is the name for the health insurance exchange here in our state, will be going live with their website. People will be able to pre-register for benefits in the exchange.
And get prepared for actually what's coming on for the Affordable Health Care Act, correct?
That's a key portion of what the Affordable Health Care Act does, which creates this health insurance exchange.
Who can apply?
Anybody who makes 138% of federal poverty level, up through 400% would get a subsidy, and even beyond that, even if you don't get a subsidy, you can apply. So just about anybody can go on the website and see if they can purchase coverage and if it's a good deal for them to purchase coverage.
About how many people in San Diego might be?
We're expecting in the first year that there'll be somewhere between 30 and 60,000 that will subscribe to a plan in Covered California, one of the 6 health plans that have been approved by that organization.
I know there's about 13 tentative plans approved. Can you give us some examples of what they are?
Well, for San Diego, there are 6 plans that will be active, will be offering insurance to San Diegans. So that'll be Sharp Health Plan, Kaiser, Anthem Blue Cross, Blue Shield, Molina, and I'm forgetting the 6th offhand.
We'll have it on our website. What sort of benefits do these plans offer? Are we talking full medical, dental, vision? What's sort of the caveats?
There are 10 items that are considered essential health benefits that all these plans must provide. So you're talking mental health services, you're talking hospitalization, you're talking different types of specialty care, you're talking pediatric, oral health, and vision. So a wide variety of things, anything you can think of, including rehabilitative
But as you
care.
said, there are essential elements that they all must cover. How much do these plans cost as far as a range goes?
You know, it's really going to depend. It depends on the subsidy that one gets. The less that one makes, the greater a subsidy you're going to get towards a premium or towards a copay. So for example, I'm the president of a small nonprofit. We have 1 employee. He doesn't have health care, but we decided we're going to provide health care for him in the exchange because he's in his early 60s. And he makes just at the end that he can be subsidized in the exchange. It's only going to cost about $260 a month to cover him in full.
Okay. What if you're really somebody looking at these plans and you just can't afford it? You're making minimum wage or the poverty level, or you're living in your circumstances, you can't afford it. What do you do?
Well, if you're in poverty, you're probably going to be eligible for the Medi-Cal expansion. Totally separate program.
Right.
But overall, people are going to have to subscribe to some type of health plan or pay a penalty for not subscribing.
And that was my next question. Tell us about the penalty. So just to be clear, you can do the exchange program or the Medi-Cal, which is completely separate for people who qualify for that. But you have to sign up for something, and if you don't, what happens?
If you don't, and you're not exempted for extremely low wage earners or other specific situations, then you would pay $95 in the first year or 1% of your income, whichever is higher. And that goes up over a series of years, what the penalty will be. And that would be assessed as part of your, when you pay your income taxes.
Okay. Tell us about some of the major confusion that you've heard the public that you would like to clear up when it comes to this Exchange Act.
Well, some people believe that it hasn't been passed at all, or it's not happening, or that it's been delayed, and it hasn't. The exchange is going forward. In fact, California is probably the furthest along of any of the states in having the exchange up and running by having grants for organizations like ours to go out into the community to do outreach and education. They're even testing the site right now. They've asked for beta testers in the 3 call centers up in Northern California to be able to make sure that the systems works on the day 1 on October 1st when people are eligible to start to pre-register, so to speak. Insurance won't go into place until January 1, but people can pre-register before then.
All right, Gary Rado with the Council of Community Clinics. We will stay in touch with you and get all the updates as this progresses. Thank you so much.
A pleasure.